there's 3 reasons why I believe ScoliBalance is better than Schroth for treating scoliosis. Hi, I'm Dr. Chris Skubals, the head clinician here at ScoliCare, and today I'm going to go over 3 specific reasons why I believe ScoliBalance tends to be a better scoliosis-specific rehabilitation method than Schroth for most patients with scoliosis, and why we use it every day here at ScoliCare. Reason number 1. Schroth was first started or invented back in 1921 by Carolina Schroth, who was not actually a physician or a physical therapist. She was actually a patient with scoliosis. And she developed what is known as rotational angular breathing, which is a key component of the Schroth scoliosis method. And then Schroth was later systematized by her daughter in the 1960s. My point being, Schroth is really well known because it's the oldest method out there, and it's been there for a long time. And it's very famous for its rotational angular breathing. And it's really appropriate, or doing that can be really good for some patients, specifically patients that have a huge rigid or big thoracic scoliosis, because that's where your lungs are. But not everyone's scoliosis is in their thoracic spine, and not all patients have a primary curve in the thoracic spine. And what we tend to see, or frequently see, is patients who have gone to Schroth therapists and then coming into ScoliCare, they're doing rotational breathing, even though their main curve or their only curve is in their lumbar spine. So the rotational breathing is not the most effective or the most important for that. What we also find sometimes is therapists will get trained in Schroth or other methods, and they tend to do the exact same thing for each patient. And where it may be really effective for some patients, some of the things they're doing, we know there can be better or more effective scoliosis rehab methods or exercises done for them. The second reason is Schroth can be really hard and complicated for patients to do. It can involve putting the patient in a lot of different positions and using lots of different devices. It can be very technical. Now that's really strenuous and hard for both the patient, but also the provider. And because it's hard, it can be really hard for patients to do it on their own. So they have to rely on going to the clinic to do it. Many times patients are having to do treatment several times a week. With any method of rehab, at some point you want the patients to be able to do it on their own. So if it's really complicated and it can only be done properly or effectively by the direct assistance of the scoliosis therapist, that makes it really non-sustainable because the patient can't do it on their own. We get a lot of patients that come to ScoliCare that have done Schroth in other clinics, and though some may have liked it or they got some benefit, one of the complaints we hear is it was too hard for them to do on their own, and they were always relying on going to the clinic to be able to effectively do the Schroth scoliosis. One of the reasons we actually developed ScoliBalance, or one of the great things about ScoliBalance, is it's a lot simpler and easier to teach the patients, and it makes it easy for the patients to do on their own outside of the practice. In fact, we give patients an at-home program that they're doing 3 to 6 times a day at home, and that begins after the very first session. So one of the things that's really important for any scoliosis rehab to be effective is it has to be sustainable for the patient. And so the patient has to be able to take that and use it on their own, not relying 100% on doing with the therapist, and it has to be something they can also incorporate into the daily life. And the third reason I believe ScoliBalance is a better, more superior scoliosis rehab method is scoliosis is a new modern technique. In fact, with ScoliBalance, we combine several different methods. We use components from Schroth when it's important. We use components from SEEDS, the scientific exercise approach to scoliosis treatment. And we also take things from like chiropractic biophysics. So we combine several different techniques, and our therapists can look at each individual patient and they can pull from each technique depending on what's the best and most effective treatment for each individual patient. And by doing that, we believe we can get better results faster and more effectively. And we can make it easier for the patient to do it on their own, so they're not relying on the practice for a long period of time. Now, when we're talking about scoliosis-specific exercises, it's important to know these are all very different than traditional physical therapy. There's 4 components for something to be considered a scoliosis-specific exercise or therapy. 1, you have to teach the patient how to put themselves or their body in a 3-dimensional corrected position. 2, you have to strengthen and stabilize them in that correct position. 3, you have to actually teach them how to hold their body in their correct position while they're doing normal activities of daily living, meaning teach someone to do that corrective exercise while they're doing things they already do in their everyday life. That's also what makes it sustainable long time. And four, there has to be an educational component because patients have to really understand what's going on with their body so they understand what has to be done to correct their body. Now, if you're out there watching this, you probably have scoliosis. You may be wondering, what's the best scoliosis exercise or method for me? What I'm going to encourage you to do is click on the link below and request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. I can tell you how severe your scoliosis is. I can tell you the risk of it progressing or getting worse. And I can let you know the most effective treatment options for you. And for more in-depth knowledge about the most effective scoliosis treatment options today, click on our next video and I'll see you there.